President Obama gave the longest speech of his presidency and the most comprehensive one he's ever given about health care reform, speaking to a group that perhaps Americans trust the most on this issue, doctors. So how will the great debates in this issue impact you at your doctor's office?
The president acknowledged the importance of the doctors, your doctors, who filled the audience at the AMA convention.
To most Americans, you are the healthcare system. The fact is, Americans, and I include myself and Michelle and our kids in this, we just do what you tell us to do.
But doctors say costs are out of control because they conduct so many unnecessary tests and referrals for fear of malpractice lawsuits. And some booed the president when he told them he would not do what they recommend when it comes to medical malpractice reform and limiting the size of the awards juries give.
I'm not advocating caps on malpractice awards, which I personally believe can be unfair to people who've been wrongfully harmed.
This could impact how many tests and referrals your doctor prescribes and your ability to sue should something go wrong. It's just one hurdle of many. Another one, cost.
Making health care affordable for all Americans will cost somewhere on the order of $1 trillion over the next 10 years.
Will that money come from you? The president says this can be paid for by increasing taxes on those who make more than $200,000 a year and making cuts in Medicare and Medicaid. Then there's the hurdle in which the president will face off against the powerful insurance industry over whether there should be a government-run plan.
A public option that will give people a broader range of choices and inject competition into the healthcare market.
And the big subject here in Washington today is the fact that the Congressional Budget Office, Robin, has looked at one of the Democrat bills on Capitol Hill, that from Senator Ted Kennedy, and said it would cost $1 trillion over the next 10 years and only add a net increase of 16 million people to the ranks of the insured, leaving behind tens of millions. The administration's response is the legislative process is still fluid, and that is not their bill.